Yes, hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So very interesting case. This is a nice patient. Comes to me from Nevada. Initials DM. And as you will see, 100% total capsulectomy, 7/15/25, initials DM. The right side, left side, she had her first set of implants in the year 2000, which were saline. Then she ended up getting what is capsular contracture. In 08, she had the implants replaced also below the muscle. And then because of the capsular contracture, she had the left side done the third time. And now she was severe capsular contracture and pain, which is what a grade 4 capsular contracture is on the left and also on the right. So her right implant was 17 years old, left one was 13. So if you look at grade 4 capsular contracture, this is the highest. This is the Baker's classification. The breast is deformed, painful, and visible, and you can see it's riding relatively higher up. And you can see, look at these are nice two big round balls. Complete total capsule removal plus implant, very thin capsule. I have my sterile glove that I'm going to touch the left side with another pair of the green gloves that I have underneath. So as you will see, the green gloves. So those are sterile as well. So very thin capsule, and as you will see, the whole goal is removal of the implant capsule, and this is the inflamed tissue that was present. So let me cut this open. You can see it is overfilled saline implant, and according to the patient, this was filled to 440. So as I go in, you will see this tissue is not healthy, and that's why I removed it. This is not good volume. And as I go in, the entire capsular tissue is removed so that no inflamed tissue, capsular tissue implant is removed as one system. So as I go in, you can see, someone can say, well, leave this tissue behind, but you can see, look at the scar tissue, the capsular tissue, the inflamed tissue in the periphery. And this implant was indeed upside down. You can see the back part of it. So I'm going to go in. And so this tissue is not good. It has to be removed as well. So in my practice, I remove it as well, so as to give the patient the best chance of recovery. So here I go. You can see how thin the capsular tissue is. And as soon as I go in, we will see what type of an implant. This is your Mentor implant 380. And I can see it, Mentor 380 implant. Overfilled clearly, as you can see, the pressure on the sides, and you can see the one thing I want to show here with my gloves is I remove this. You can see it's a very subtle but leaching of that silicone from the silicone shell of the saline implant. And overfilled, you can see the pressure on the side, not good to do. And you can see if I put this on top of the reeler, this is how thin the capsular tissue. No matter how thin, the whole capsular tissue is removed. You can see right here, this is the tissue. You can see some veins back there, and the tissue in the back has also been removed completely, faithfully, sincerely. Remember, in my practice, that is the whole goal and gist of the surgery, and very hard. So nothing out of the ordinary that I see. This will be sent certainly indeed to pathology so that we can rule out that very rare BIALCL, squamous cell cancer, breast cancer, anything malignant. So I'm going to remove my top sterile blue gloves, and I am going to now have what are sterile green gloves underneath. So you can see some tissue, and I'm going to dissect through this complete. So for contouring purposes, this is the excess skin that I've removed. And you can see this helps with the contouring, and as you will see, complete entire implant capsule, all inflamed tissue. Now let me show you why I removed this. So as I dig this, cut through this, you can see this tissue is not healthy, a lot of inflamed tissue, and I'm going to cut right through it. And you can see it's scar tissue, inflamed tissue, irregular tissue on the side, sitting on top of the muscle. So I'm going to go in over here. The capsular tissue. So this tissue has been studied before, and this is what they sometimes report as histiocytic reaction, giant cell reaction. Sometimes they read this fat necrosis in the pathology report, and so there is no doubt that all of this. So this was end block, 100% total capsulectomy, and as you will see, you can actually hear the capsule being cut. Again, what is an overfilled? You can see the implant starting to break down. Intact saline implants. Remember, saline implants are like a water balloon. So if I go in, this is that leaching of the silicone. So Mentor 380 as well, overfilled implant. And as you will see, look at this white tissue. Capsular tissue. You can see my green glove. This is how thin that capsular tissue is below the muscle, right on top of the rib. And overall, I'm very happy. I'm going to go ahead and, for completeness sake, cut right through this. You can see it's very hard tissue. I'm having a hard time. Inflamed tissue right here. And it does not look healthy. Look at the color of this fat. This is not healthy fat. This is healthy fat right here. This is a little bit dusky and has a different consistency, texture. So we'll see what the pathologist says. So in my practice, this is like the con procedure. The implants are returned to the patient. Overfilled implants will be returned to the patient. It is not healthy, not normal for a surgeon to overfill because it loses its warranty and it's not safe. They're more prone to rupture. So the implants will be returned to the patient. Capsules to be sent to pathology. Rule out the BIALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out BIA-SCC, which is the squamous cell cancer, breast cancer, anything abnormal. Cultures for aerobic, anaerobic, and fungal. No need for an unnecessary lift in this patient, given the significant contracture she had not only on the left and the pain, but also on the right, and very likely, given her age, she will not need it. No need for unnecessary drains. The blood loss was less than 5 cc's on each side. And then twilight deep sedation, which is where she has the propofol fentanyl Versed. She was not paralyzed. And then she got the same surgery that everyone does. And then certainly not only the high definition videos and pictures of what you see right now, but more importantly, and this is the take-home message, of the chest wall showing the complete chest, where there is no capsular tissue, no inflamed tissue, with only good, healthy, viable tissue remaining behind. So in my practice, I give the videos and pictures of the chest wall showing that this is exactly how it was done. And it is only inadequate to show the cutting open of the capsule on the table. And every patient should ask so that they have that complete, objective, physical evidence that the entire capsular tissue, inflamed tissue, was removed sincerely, completely, honestly, and definitively. This is Dr. Khan, Executive Plastic Surgeon.